All right, welcome everyone to the 2022 PI Conference. We're going to start this session in just a moment. My name is Emma Mertens, and I'm the Program Manager of Community Relations at IDF, and I will be your moderator for this education event. Today, Dr. Elena Perez will be presenting on the topic of navigating school transitions when diagnosed with SCID. There will be time for questions at the end of Dr. Perez's presentation, and please submit any questions you have for our presenter in the Q&A section on the platform. Dr. Elena Perez graduated from the University of Florida College of Medicine with a combined MD, PhD degree in 1998. She completed her residency in pediatrics in 2001 and fellowship in allergy and immunology in 2004 at the Children's Hospital of Philadelphia, where she stayed until 2008 as an assistant professor. In 2016, she joined Allergy Associates of the Palm Beaches, where she is currently practicing allergy and immunology and caring for children and adults with these conditions. Dr. Perez is board certified in pediatrics and allergy and immunology. Her clinical expertise is in primary immunodeficiency disorders and allergic conditions, including asthma, eczema, and food and environmental allergies. She was actively involved in the addition of newborn screening for severe combined immunodeficiency, or SCID, to the newborn screening panel in Florida, which started in October 2012. Welcome, Dr. Perez.
Thank you very much for inviting me to talk today at the meeting. I'm very happy to be here, and going through this talk reminded me of some of my very special patients and the journeys that we've been through together over the years. So the topic I was assigned was back to school with SCID, considerations for each stage. And there's a lot to talk about, so I tried to kind of really hone it down a bit, and hopefully there'll be time for some questions. Let's see, how can I advance my slide? There we go. Before we get too deep, I just wanted to refer to this IDF publication, which recently was updated. It is the IDF School Guide for Students with Primary Immune Deficiency. And there's going to be a lot more information available there, especially for some of the questions that might come up as we go through the talk. So I tried to divide it up into age groups, but as you will also see, a lot of the same themes carry through from age to age. So for the elementary and middle school groups, first, I would like to talk a little bit about talking with the administration of the school and what kind of goes through your mind as your child is getting ready to go to school with the diagnosis of a primary immune deficiency, and maybe even a long journey, or hopefully these days with the onset of newborn screening, a shorter journey through transplant and through the challenges that had come on early when you found out about the diagnosis, and hopefully now getting ready to transition into school. I'd like to talk a little bit about vaccinations and outbreaks and doctor's appointments, absences, and then gammaglobulin as well. So talking with administration, I can imagine that going through a parent's mind is, privacy issues. Do I want to tell the school about my child's diagnosis? Is it going to set him apart from his peers? Is it going to cause more problems than solutions? But you might consider talking with the teachers and talking with the administration, particularly if your child has to take a medication at school, if there's increased absences expected because maybe they're not quite through or stable yet with regard to specialist appointments that they need to make, if accommodations or modifications are needed, and if there are specific emergency procedures that need to be followed. Notifying the school of the diagnosis before the school year begins, or as soon as it is practical is important, because that will give you time to make plans and put things in place for your child. Oftentimes I've been asked as a medical doctor to provide a letter regarding my patient's medical condition. And you probably want to be specific to a certain extent in the request for those letters, exactly what information you want to disclose and what information you feel would be useful to the team at the school to know about. We have to consider HIPAA, and we need your permission to disclose certain types of information. So things that they talk about, and again, it's elaborated in that IDF guide, is what is the medical condition, what is the treatment, and if necessary, what could be some recommendations for accommodations or modifications to their educational experience. You also want to meet with the administration ahead of time if you're going to be requesting special accommodations, which are through certain programs called 504 or IEP. And I'll get briefly into that. I have to say, I'm not an expert on 504 or IEPs, but I have helped patients and patients' families kind of think about what are the issues that they want to include. The 504 plan is a document that's developed by the educational team to provide accommodations and or modifications that help a student with a disability succeed in school. So in order to have a 504 plan, you have to prove that the student has a disability and that accommodations or modifications are required in order for the student to receive an education equal to their classmates. You need to request a meeting with the appropriate school personnel, and this can vary from state to state and school to school. Usually they want a letter from your student's healthcare provider. And what they mean by accommodations is any technique that alters the academic setting or environment. So for example, if your child needs a special bathroom pass, that's going to not usually be given to most kids. So certain little exceptions like that could be made for your child to have them have a better experience at school. Modification is any technique that in some way alters the work required to make it different from the work required of other students in the same class. So this would be like making an exception for having a shorter assignment or a different due date due to illness or due to challenges that your child is facing. And here the disability is defined as a person with a physical or mental impairment that substantially limits one or more major life activities. And they discuss in the IDF guide that this includes the immune system with a record of such an impairment or who are regarded as having such an impairment. The IEP is different. It's an individualized education plan. And this is also a written document that's developed for students ages 3 to 21 who meet the educational qualifications for special education under the Individuals with Disabilities Education Act. And this is created to meet the educational needs of an individual student and to provide for an opportunity for teachers, parents, guardians, and school personnel and students to work together to improve the educational results for the student. And it is reviewed at least once per year. But before this IEP can be developed, it is law that there has to be a multidisciplinary IEP team that needs to determine that the student is eligible for special education and that they have a disability which is negatively impacting their educational performance. So the two documents are different and they have different goals. There's yet another more probably simple and sometimes even goes along with these two documents called an individual healthcare plan and an emergency healthcare plan. So this is more of the school nurse helping to write a healthcare plan specifically for what's going on in the school setting. It outlines the management of the school and healthcare services for the student who has a chronic health condition. And it's developed by the school nurse along with the parents and the students if appropriate. And this really is centering more around provision of healthcare in the school-based setting. It's not based on any requirements of showing disability. And even though sometimes this might be a good document to have if you're using a 504 or an IEP. Okay, so that's like the administrative stuff that like I mentioned, I'm not really an expert in, but it is a lot of navigation and a lot of probably practice makes perfect as you go through the process. So you need to identify who are the administrators at the school that can guide you in the right direction, and then really use that IDF booklet because there is a lot of good information there. So as a parent, one of the questions that I, as a doctor, listening to my parents of kids who have immune deficiency, one of the biggest questions that would come up every year was, what vaccinations did they need to get into school? And historically and generally speaking, live vaccines are usually contraindicated for most immune deficient patients, especially those who don't have good T cells. So definitely in patients who have SCID. And the live vaccines are the MMR and the varicella and also the rotavirus. So these are things that we almost never give to patients unless they have a really strongly constituted immune system. So after transplant, and these guidelines may have changed since back when I was hanging around with the transplant doctors, they would come up with a schedule of vaccines that would be allowed to try to catch up. But this is usually done when a patient has reconstituted their immune system enough to be able to respond. And some patients don't ever get to do that. And so they are dependent on gammaglobulin therapy to provide those antibodies. And so a lot of vaccines can kind of be foregone in patients who are on gammaglobulin therapy because you're going to be getting protection from the gammaglobulin. You might need an exception that has to be written by your pediatrician or by your immunologist due to the immune deficiency. And these rules and regulations vary by state. I put here on this slide a reference to the CDC website, which talks about what kind of vaccines you need to get into school, and it helps also kind of guide you by state. So I thought that was a very good reference to look into if you're asking that same question. The other topic that has come up a lot as my patients are growing up and being exposed to new germs is whether there would be an outbreak in the school, what should they do? And because our patients cannot get vaccinated or don't respond so well to a lot of vaccines, and they are dependent on the herd immunity from their surrounding counterparts to protect them from these kind of outbreaks. And so that is why it was so important for everybody to get vaccinated for the COVID pandemic, because we had people who have immune compromise in our population, whether it's from a primary or a secondary immune deficiency situation, who are more vulnerable to infection because they don't make good responses. So in a school setting, there could be outbreaks of various infectious diseases, and parents really feel vulnerable at that time. Do I send my kid to school? Do I hold them back? Do I homeschool? What can I do to protect my child? And so back when I was a fellow in training, we used to use serum immunoglobulins that were concentrated for chickenpox or measles, or we thought of ways to do post-exposure prophylaxis. And the latest thinking, at least for measles and chickenpox, is that if you have had IVIG within 3 weeks of your exposure, you should be good. But just to know that there is also a hyperimmune serum called Varizig, which could be used in certain situations. I don't think it's so easy to come by in the community away from big medical centers, but I would probably kind of rely on the latest recommendation that if you've had IVIG within the last 3 weeks of exposure, you're probably going to be okay from that exposure. I have seen incidents where you might give an extra IVIG dosage or a partial IVIG dose due to an exposure. So if you do have an exposure, make sure you let your immunologist know and discuss that to see how they want to move forward. Influenza, we're getting into influenza season now. Tamiflu has actually been used down to 3 months for post-exposure prophylaxis. It does have some possible side effects of nausea and vomiting, but the earlier you start it, the better it should work. For COVID-19, now there's Paxlovid, and there's some monoclonal antibodies available that seem to kind of change every few months. Those are all indicated for kids greater than 12. And then hepatitis A outbreaks are usually handled by giving the vaccine if you're greater than 12 months plus an IM dose of gamma at 0.1 mLs per kilogram, or if you're less than 12 months, then just a IM IEG dosage. For meningitis, there's a vaccine available for preteens, and then there's a boost that's given at 16. I would just be mindful if there is an outbreak there to get them out of that situation. Again, because depending on their immune system, they may not respond to that vaccine, or they may be on, still relying on gamma globulin. MRSA is another one. Sometimes you'll see people get recurrent boils on their skin because they've shared towels or gym equipment, things like that. Sometimes you'll see some multiple people getting these boils on their skin or MRSA infections. And so good hygiene and not sharing your gym clothes, not sharing your gym towels is helpful for that. And sometimes the immunologist will prescribe mupirocin, which is a topical antibiotic that may decolonize you from MRSA. Usually they put it under the nostrils for several days. So if there is an outbreak at the school, the best advice I would say is that first of all, that maybe that would be part of your plan or part of your communication with the teacher to let you know discreetly if there's an outbreak in the classroom of chickenpox or measles, especially, and to consult with your immunologist. With regard to doctor's appointments and absences, you may need to ask for assignments early or extra time to do work. I'm sorry, there's a little bit of noise in my office. I'm just going to close the door for a second.
Yep.
Sorry, there's a clinic going on in the hallway. And you may need to, I also try to have the parents discuss with their child, and even at our office visits, to try to get the child to start to engage in discussions regarding their diagnosis and what do they understand. This can be a very stressful time for kids who have been through so much at a very early age and have just seen doctor after doctor, and there's a lot of anxiety there, and then they're moving to a school setting. And so I can't emphasize enough the importance of talking and giving them a safe space at our office visits to let us know what's on their mind. And some children are more receptive to it and others. And I would say give them, in due time, they can, go at their own pace for this sort of thing. I urge my parents to keep a health notebook, whether it's virtually through the IDF or in a binder, to help communication, and then to communicate frequently with teachers if there's changes to the condition, to your child's condition, or to the amount of medical appointments that are needed, or if there's an ongoing illness that needs to be dealt with, and to develop a plan if you see that your child is going to become more absent, or make time for going to get your IV infusions and things like that. Circling back again to the psychosocial needs of the student, when they've been gone for a long time from school, they may feel like their friends have forgotten them, or they might feel that they've lost some of those connections. And so I sometimes advise parents to look towards a counselor, or whether it's at school or a private counselor that can help the student work through all of this and learning how to deal with a chronic condition. It's important to de-stress, and it's important to have coping mechanisms for when it's just getting to be too much. Okay, the next topic I have here is gamma globulin. So you all know probably by now that we can do this through several routes. We can administer it through the IV route or the sub-Q route. One of the things I've noticed through my years of practice is that needs change over time. Sometimes when the child is a baby, it might be easier for the parents to administer subcutaneous. Or if there's an illness that's requiring a port, for example, which we don't generally like to use, but in certain situations there may be a port, maybe IV would be easier that time. As children grow, there might be issues with privacy and not being reminded that they need to be on gamma globulin. So less frequent dosing with IV might be the choice, or kids might want to start to become independent and say, I want to take charge of this. And then sub-Q might be it. And it's okay to go back and forth. You should have a supportive immunologist who talks about that at each visit and make sure that things are going the way that you want them to go. And ask the patient, ask the child, are you okay with the way things are being delivered? And these things have to be reassessed over time. Remember that sub-Q sometimes can give you a little bit more independence and maybe not disrupt the school time as much. Whereas IV, you're gonna have to make an appointment for several hours out of the month on a repetitive schedule. So that was kind of elementary and middle. And like I said, these same themes, go throughout life. In high school, now they're getting a little older and they're going to start thinking about college. Do you want to have a college that is close to home or far away from home? And what is the access to care? Are you going to be near a medical center? Are you going to be near your immunologist? And if you're not going to be near your immunologist, what arrangements can be made to keep in touch with them? Are there going to be privacy issues in the dormitory? Where is your child going to get infused if they're still on gammaglobulin? There's a lot more issues with independence. I try to foster as much as possible self-advocacy skills, make sure that your child is learning about their condition and what needs to be done to keep them well. This term called medical shared decision-making is really kind of a newer concept where instead of telling you, you're going to do this, you're going to do this, you're going to do this, now we're trying to involve the family and the child in understanding what the options are and explaining what the options are. What are the pros and cons of doing things a certain way? And then allowing the child to have a voice in that decision. Again, that same idea of IV or sub-Q, just to mention that peer support may be very important at this age. This is kind of an age that I'm finding out now with one teenager and two preteens of my own. They don't necessarily want to talk to mom and dad so much right now. They kind of want to figure it out on their own. And there could be a little bit of stress or friction there. And so referring them to peer support through the IDF especially may help connect them with other kids who are going through similar situations and have similar concerns or worries. And that might be a nice outlet for them to kind of feel empowered and learn more about their condition. Another peculiar question, especially in the setting of immune deficiency, is what kind of summer jobs and hobbies are safe? And so I recall one of my dear patients wanting to work in the garden or wanting to work with animals, and what kind of zoonotic or animal derived infections might they be susceptible to. So there are challenges along the way. You want them to pursue what their joys and interests are, but you want to keep them safe. And so if anything like that comes up, I would urge you again to have a conversation with your immunologist and try to analyze what could be the exposures with this job or hobby and what precautions should be taken to prevent infection and prevent exposures. And then the teenage years continue, and they may be faced with things like temptations to smoke or vape or get tattooed or get pierced. And all of these things, obviously, we want to keep the child safe. And I would discourage smoking on all fronts, especially for someone who has an immune deficiency. I wouldn't want to cause any damage to the lungs or cause an infection in the lungs. As far as tattooing and piercing goes, I would have a heart-to-heart with the patient and with the family. And, if it was something that the parents were supportive of, make sure that you do it in a aseptic way that is not going to be dangerous for the child or infectious possibly for the child. Personal hygiene is also something that comes up quite a bit in high school. Dating, what sorts of things do they need to disclose to their friends and to their boyfriends or girlfriends? All of these things come up as questions for teenagers, and the stress of the pandemic, I think, has made a lot of kids in that age group very anxious. And so I do see the value of counseling, plus all the same issues that we talked about from the previous slides. And then in college, things to think about are dorm life, access to specialists, again, the gammaglobulin site of care. Some kids might not want to infuse themselves in their dorm. Also compliance. You might want to find out if the medical center attached to the college would do the infusions at their clinics or at student health. Excuse me. What accommodations can be made? How important is it for them to have a private dorm or not, depending on what their susceptibilities to infections could be, whether or not they need extra time for assignments. And you may need a letter from your immunologist again to try to get some of these accommodations in college. And then we try to support them through their transition to adulthood, taking on responsibility for their own health needs. I just want to refer everyone back to the IDF again. There are sample letters available in that document that I referred to at the beginning of the talk. Sample letters from the healthcare provider, requesting a meeting for school, planning the 504 or the IEP. All of those things are nicely laid out in that document. Even meeting and conference planner, so you can keep track of the meetings that you've had with the school. All of that is available in that booklet. So generally, in summary, just to make some time for questions and discussion, hopefully, there are many transitions along the way, but there's also resources available to support you. You might want to try, if you can, to anticipate issues ahead of time and think of some questions ahead of time before that next milestone comes. What is that going to look like, and what questions do I need answered? Work closely with your immunologist and empower your child to become an independent adult by learning and participating along the way as much as possible. Look to resources such as the IDF, and like I said, maintain relationships with your immunologist. We love to watch everybody grow up and make that journey as healthily and safely as possible. And then consider seeking support through counseling for the patient, even for the family, for dealing with a chronic condition. It's not easy going through some of these, living with some of these conditions. And remember to de-stress and take some time for yourself. So I think with that, I will end it and see if there's time for questions.
Wonderful. Well, thank you so much, Dr. Perez, for sharing that super important information. And we know that it can benefit parents of children with all types of PI, not just SCID. So thank you for including those IDF resources as well. We really encourage everyone to check those out. Again, I think this advice and this guidance is good for parents of kids with any type of PI, not just SCID, even though this session is about SCID. All right, so now we do have some time available for Q&A, but before we begin, please remember that everyone's treatment and condition is unique. The information presented during this session is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with questions concerning a medical condition. All right, so let's take a look at our questions so far. All right, so first question. When discussing vaccinations for my school, can I have my child's immunologist discuss with my child's primary care provider about vaccine schedules, timing, or what they can or cannot receive?
I think that is a great idea. I've done that before for some of my patients. Most immunologists who take care of primary immune deficiencies are pediatricians themselves, so they should be pretty familiar with the schedule of the recommended vaccines. But nonetheless, the pediatrician of the child is a vital member of the team. And so I do encourage that discussion to happen between the two. And sometimes they need guidance because maybe they don't understand which vaccines are contraindicated for the particular primary immune deficiency. And just to mention, not to stir the pot too much, but there are some immune deficiencies, for example, DeGeorge syndrome, where even though the package insert of some of these vaccines tell us, it's contraindicated to give a live vaccine, some patients with DeGeorge, depending on how well their T cells look, have successfully received it. Even before they were diagnosed, they received it. So there are caveats along the way. And so I do think it's a good idea.
Wonderful, thank you. All right, next question. At what point do I start bringing my tween/teen into medical discussions and conversations? I want him to feel prepared and independent when he goes off to college and starts his journey into young adulthood.
I think it's a very personal decision. I don't think that it's a one size fits all for every family. I've seen the profile of the family where the mom is in charge of everything and is just doesn't want the child to even think about it or talk about it or be involved with it for as long as possible because we're trying to protect them. But I've also seen the model of the parents who are involving them from a very young age to kind of understand and empower them to the ability that they can handle at that age. So even kids, I have heard of children self-infusing at very young ages sometimes. And so it's very child and family dependent. It's kind of got to be what's right for you. But I would say probably the earlier in the journey, possibly the better if it seems like a right fit for your family, because the more information they have and the more they feel in control, probably the better off they're going to be in the future. I mean, people get scared of things that they can't control. People get anxious when you can't control things sometimes. And so being armed with information helps us then know what we need to do about it. And, anticipating things before they happen will help them be a little bit more prepared. So I would encourage early preteen kind of age range, but again, it's a very patient and family specific situation.
Thank you. All right, and our last question is, my college-age child who is on IVIG really wants to study abroad. I have a million questions about that, but I guess the biggest one is, will he be able to access infusions in a foreign country, and how do we set that up?
This is an excellent question that I have not had to personally deal with, except that I had a patient recently who was an adult patient on IVIG who wanted to go to Scotland. And I had to try to figure out how to get her IVIG in Scotland. And I haven't been very successful at doing that because it's challenging. We don't really understand what the system is at each different place where they're going to go. So I would, the community of immunology is very tight knit across the world, across the globe. It's very likely that your immunologist knows somebody in one of the other countries that your child might be eyeing to go to. So I would say that might be the first step, is for the immunologist to kind of reach out to some colleagues in the other places where your child might want to go to see what is the system like over there. And then another thing that came to mind was getting international health insurance. I don't really have a resource in my head that I can tell you, oh, go to this place for it. But those kind of things do exist. And that might help quite a bit to access gammaglobulin in a foreign country. I would imagine that there would have to be some kind of connection or some kind of immunologist on the other side that could help facilitate getting the product or having the insurance help get the product. It is a very, very good question. And I wonder if the IDF might have probably come across this question before, so we can ask some of our colleagues there and see what kids have done before.
Certainly. And we did have one more question come through, so we'll tackle that one. My child will be entering preschool/daycare soon. Since young children are particularly good at sharing germs, do you have any advice for parents of children under 5 entering school for the first time? I have concerns about the other children being unvaccinated.
Yes, this is a tough one. And it also depends on what diagnosis you have and how severely immunocompromised you are. So if you have a mild immune deficiency and you are on gamma globulin therapy, then probably you could have a fairly normalish experience in the young age group setting. The early day, no matter when you start getting exposed to people, whether it's early on or whether it's later, like in kindergarten or first grade, if you've never seen those germs before, your immune system has to kind of learn how to fight that germ before it can then become strong enough to get it the next time and fight it off. And so our kids who have immune deficiency are a little at a disadvantage because their immune system might not be so good at doing that sort of thing. So I would have a plan in place, particularly if you're on gammaglobulin, to make sure those infusions are happening regularly, that we're at a good IgG level. I would see if there could be a way of encouraging the class to wash their hands. I heard that all the little babies who were born during the pandemic, because they were trained so much to wash their hands, that they would even, any little rectangular looking thing they'll go to, and they already know they're trainable to wash their hands. So I think if you could get on board with the teacher of the class to help spread the word that, you know, they don't want sick people coming to school, snotty kids coming to school, washing hands as much as possible. It's like the best you can do. Also, you might consider wearing a mask. A lot of my immune deficiency patients during the pandemic were not getting sick because of the mask wearing. So it's kind of hard to do that, keep a mask on a little one, but that's another avenue of trying to make things better. But it is a struggle, and and the reality is that you are going to have probably some challenges with viral infections, but it should hopefully get better over time, depending on how severe the immune deficiency is.
Thank you. Oh, and we're getting a couple more questions coming through, so thank you, everyone. This next individual asked, if it is within a family's means, do you recommend a private or charter school because of the smaller classes over a public school with larger classes for children with PI?
Certainly, that is a recommendation sometimes for kids to be in smaller groups when there's a risk of more infection. Again, I think it's a very personal decision of the parents, and what resources are available at a public school might not be available in a small private school. The public school has access to the 504s and the IEPs, whereas the private school might not have access, nor might not be obligated to give some of those accommodations. So I think it really depends. I would probably, compare what schools are available in your area and what are the pros and what are the cons of each one, and really kind of go towards the one that has the most resources for your child. In terms of just the quantity of people, sure, if you're around less people, you probably have a less chance of getting sick. But you also want your child to socialize and meet friends. And so it's always a risk and benefit analysis. No matter what decision in medicine we're making, it's always risk and benefit.
For sure. All right, and our last question for today will be, on the topic of international care, my family is considering a move from the US to Europe. Can our care team here help us find the right medical team in this new country?
Like I mentioned earlier, our world of immunologists is quite closely knit. There's not a lot of immunologists in the world. It's growing, our numbers are growing, but we still are pretty close knit. So, and we have ways of communicating with each other. So I would say definitely talk about it with your immunologist, because they may know somebody, or they may know somebody who knows somebody at the place that you're thinking of going to, and can help maybe from the back door kind of help navigate whatever the system is at that place where you're looking to move. And it's very different in Europe compared to the way it is set up here in the US.
All right, well, thank you so much, Dr. Perez. And to everyone who's joined us, our time together has come to an end. Thank you so much again, Dr. Perez, for leading this wonderful presentation and for answering everyone's questions. It's been such an honor to have you join us today. For those interested in learning more about SCID, please visit skidcompass.org, as well as the SCID Angels for Life Foundation booth in our virtual exhibit hall. Thank you so much, everyone, for joining us. Thank you, Dr. Perez, and we hope you enjoy the rest of the conference. Take care.
Thank you. Bye-bye.
Thank you.